Hepatic steatosis, also known as fatty liver disease or widespread hepatic steatosis, is a disorder where the liver cells become occupied by excess fat. Since the liver is essential for fat metabolism, it is the most common site for fat accumulation. It is considered harmful when fat accumulation in the liver approaches or surpasses 5% of the hepatocytes, the cells that make up the liver. Usually, the liver contains some fat. Moreover, within the next 10 to 20 years, more people will have liver transplants due to fatty liver disease resulting in cirrhosis than from hepatitis C and heavy alcohol use, according to research. Hello guys, welcome back to the channel. Did you know that fatty liver can lead to inflammation and damage to the liver, causing various health complications if left untreated? This article will explore the causes, symptoms, and treatment options for fatty liver disease. So let's get to know everything and get you healthy. The primary internal organ in the human body is the liver, which is situated on the upper right side of the belly. The liver's natural jobs include breaking down nutrients from food and eliminating poisons. Before entering any other part of the body, blood from the digestive system passes through the liver for filtering. The accumulation of extra fat in the liver cells is known as fatty liver disease, steatosis, a prevalent liver ailment in Western nations. Approximately 1 in 10 persons are impacted. Although some fat is acceptable in the liver, if fat makes up more than 10% of the weight of the liver, you may have a fatty liver and face more significant consequences. Although a fatty liver may not harm the body, too much fat can occasionally cause the liver to become inflamed. There is liver damage associated with this illness, known as steatohepatitis. Did you know that fatty liver was renamed, and now the disease has another name? Let's talk about it first. We should know the disease inside out to fight it. The term fatty liver disease was previously used to describe the condition now known as steatosis liver disease. However, to better reflect the various causes of this condition and eliminate any potential stigmatization, medical professionals decided to rename the illness and its subtypes in 2023. The new term, steatotic liver disease or SLD, acknowledges that factors other than weight or body mass index or BMI can contribute to the development of this condition. While obesity and excessive body fat are known risk factors, it is essential to recognize that other underlying factors can also increase the likelihood of developing SLD. The decision to rename the disease was made to promote a more inclusive and accurate understanding of the condition. By avoiding language that may be stigmatizing or judgmental towards individuals with SLD, the medical community aims to foster a more compassionate and supportive approach to diagnosis, treatment, and care. It is essential to note that renaming the disease remains the same fundamental understanding of its causes, symptoms, and treatment options. The aim is to promote a more comprehensive understanding of the condition while ensuring that individuals with SLD receive the appropriate medical attention and support they need. As with any medical condition, it is always recommended to consult with a healthcare professional for an accurate diagnosis, personalized treatment plan, and ongoing management of steatosis liver disease. What kinds of liver illnesses are classified as fatty? Furthermore, let's discuss the different types of liver diseases classified as steatosis or fatty. One type is alcohol-related steatosis liver disease or ALD, which occurs when a person drinks excessive amounts of alcohol. The liver responsible for filtering alcohol can become overwhelmed and damaged. This can lead to fat accumulation in the liver, resulting in steatosis or fatty liver disease. Another type is steatotic liver disease linked to metabolic dysfunction, MASLD, previously known as non-alcohol-related fatty liver disease nafld. MASLD is associated with conditions like obesity, type 2 diabetes, high blood pressure, and lipid abnormalities. These factors can contribute to fat buildup in the liver, causing steatosis. It's important to differentiate between these types of steatotic liver diseases as they have different underlying causes and associated risk factors. Risk factors associated with MASLD include family history of fatty liver disease or obesity. Growth hormone deficiency means the body doesn't make enough hormones to grow. High cholesterol, high levels of triglycerides in the blood. Insulin resistance, metabolic syndrome, obesity. Type 2 diabetes, high blood pressure, lipid abnormalities, Lipids are fatty compounds found in cells. In addition, let's discuss some other types of fatty liver diseases. One type is steatohepatitis linked to metabolic processes or MASH. This occurs when severe fat accumulation in the liver leads to inflammation, tissue damage, and scarring. MASH was previously known as non-alcohol-related steatohepatitis or NASH. There is also a condition called increased alcohol consumption with metabolic-associated fatty liver disease or MetALD. This happens when alcohol use and metabolic risk factors contribute to the accumulation of fat in the liver. If you consume more alcohol than recommended limits, more than 140 grams per week for individuals assigned female at birth, and more than 210 grams per week for individuals assigned male at birth, you may be at risk for MetALD. It's important to note that fatty liver diseases can have various causes other than alcohol consumption or metabolic risk factors. For example, steatosis can be caused by certain illnesses or medications. Sometimes, healthcare professionals may not be able to determine the exact cause, and this is referred to as cryptogenic fatty liver disease. Understanding the different types of fatty liver diseases can help healthcare professionals diagnose and manage the condition effectively. If you suspect you may have fatty liver disease, it is essential to consult with a healthcare professional for proper evaluation and guidance. Now you are ready to move ahead, and let's discuss the causes of this deadly disease so you know which things to avoid to keep yourself healthy. But before we move ahead, if you enjoyed this video, hit that like button and subscribe to the channel. Let's talk about causes. Causes of fatty liver. Cause 1. Obesity. Excess body weight, especially abdominal obesity, is a primary culprit behind the development of fatty liver disease. When we consume more calories than our body needs, the excess calories get converted into fat and stored in different body parts, including the liver. However, the liver has a limited capacity to store fat, so when it becomes overwhelmed, the excess fat accumulates in liver cells. This leads to the formation of fatty liver disease. Not only does obesity contribute to fat accumulation, but it also promotes inflammation and insulin resistance, further worsening the condition. So it's essential to maintain a healthy weight through a balanced diet and regular exercise to reduce the risk of fatty liver disease. Cause 2. Poor diet. Our dietary choices play a crucial role in developing fatty liver disease. Consuming a diet high in refined carbohydrates, sugary beverages, and unhealthy fats can contribute to fat accumulation in the liver. Refined carbohydrates like white bread, pasta, and pastries cause a rapid spike in blood sugar levels, promoting insulin resistance and fat storage in the liver. Additionally, excessive consumption of sugary beverages like soda and fruit juices can overload the liver with fructose, a type of sugar that can only be metabolized by the liver. This can lead to fat deposition and inflammation. Unhealthy fats, such as saturated and trans fats found in fried foods and processed snacks, can also contribute to developing fatty liver disease. Opting for a balanced diet rich in fruits, vegetables, whole grains, and lean proteins can help prevent fatty liver disease and promote overall liver health. Cause 3. Insulin resistance. Insulin is a hormone produced by the pancreas that helps regulate blood sugar levels and facilitates glucose storage in cells for energy. However, in conditions like insulin resistance, the body becomes less responsive to the effects of insulin. As a result, the pancreas produces more insulin to compensate, leading to higher insulin levels in the bloodstream. Insulin resistance often occurs in individuals with type 2 diabetes or metabolic syndrome, both of which are risk factors for fatty liver disease. Elevated insulin levels can promote fat accumulation in the liver by stimulating the production of fatty acids and inhibiting their breakdown. Additionally, insulin resistance can impair the standard processing of fats in the liver, further contributing to the development of fatty liver disease. Managing insulin resistance through lifestyle modifications, such as regular exercise, a healthy diet, and weight loss, can help reduce the risk of fatty liver disease. Cause 4. Medications and toxins. Certain medications and exposure to toxins can also play a role in developing fatty liver disease. Medicines like corticosteroids, commonly prescribed for conditions like asthma and autoimmune disorders, can cause fat accumulation in the liver. Similarly, tamoxifen, a medication used in breast cancer treatment, has been associated with an increased risk of fatty liver disease. Furthermore, exposure to toxins like pesticides, chemicals, and heavy metals can damage liver cells and disrupt normal liver function. This can result in fat buildup within the liver. It is important to note that not everyone who takes these medications or is exposed to toxins will develop fatty liver disease. Still, these factors can contribute to its development in susceptible individuals. It is crucial to discuss potential liver-related side effects with healthcare professionals when taking medications and to minimize exposure to toxins whenever possible. By managing insulin resistance and being aware of potential liver-related side effects of medications and toxins, we can take proactive steps towards preventing or minimizing the risk of fatty liver disease. Since you know what causes the deadly disease, let's talk about the symptoms, because if you are experiencing these, you should be able to avoid the worst scenarios. Symptoms of fatty liver. Symptom 1. Fatigue. Feeling persistently tired or weak is a common symptom experienced by individuals with fatty liver disease. This can be attributed to several factors. Firstly, the inflammation in the liver caused by fat accumulation can lead to decreased liver function. The liver plays a crucial role in processing nutrients and toxins, producing proteins, and storing energy. When the liver is compromised, these functions may be affected, leading to feelings of fatigue. Additionally, the body's immune response to liver inflammation can also contribute to feelings of tiredness. It is essential to address and manage fatigue associated with fatty liver disease to maintain overall well-being and quality of life. Symptom 2. Abdominal discomfort. Some individuals with fatty liver disease may experience discomfort or pain in the upper right side of the abdomen. This discomfort is often a result of an enlarged liver pressing against surrounding tissues and organs. The liver may become enlarged due to inflammation and fatty infiltration. The severity of abdominal discomfort can vary from mild to more pronounced pain, depending on the extent of liver enlargement. It is essential to consult with a healthcare professional if you experience persistent or severe abdominal discomfort, as it can indicate other underlying conditions that may require further evaluation and treatment. Symptom 3. Weight loss or loss of appetite. Fatty liver disease can lead to decreased appetite, causing a loss of interest in food and subsequent unintentional weight loss. This can occur due to various reasons. The inflammation in the liver can disrupt the normal metabolism of nutrients, leading to a decreased appetite. Additionally, fat accumulation in the liver can impair its ability to produce bile, which is essential for digestion and the absorption of fats. This can further contribute to a loss of appetite and subsequent weight loss. Addressing any significant changes in appetite or weight is crucial to ensure proper nutrition and overall health. Symptom 4. Jaundice. In severe cases of fatty liver disease, a condition known as jaundice may occur. A yellowing of the skin and eyes characterizes jaundice. This discoloration is caused by the buildup of bilirubin, a yellow pigment produced when red blood cells break down due to impaired liver function. Jaundice indicates significant liver damage and requires immediate medical attention. It is important to note that jaundice is a less common symptom of fatty liver disease and is more commonly associated with other liver conditions, such as hepatitis or liver cirrhosis. If you experience any concerning symptoms or have concerns about your liver health, it is recommended that you consult with a healthcare professional for proper evaluation and guidance. I'm sure you now know the cause and symptoms of the deadly disease. Let me tell you how to avoid it with the best treatment, remedies, and proper education. DRS visits can be daunting and often not required, so for the minor treatment, you can get help from what we are about to tell you. If you are not a subscriber, hit the like button and subscribe. We would appreciate your support. Treatment for fatty liver. Lifestyle changes. Making significant changes is often the first approach to managing fatty liver disease. Weight loss is a crucial component as it can help reduce the fat stored in the liver. A gradual and sustainable weight loss of about 1 to 2 pounds per week is recommended. This can be achieved through a balanced and nutritious diet emphasizing whole foods like fruits, vegetables, whole grains, lean proteins, and healthy fats. It is essential to limit the intake of sugary foods, refined carbohydrates, saturated fats, and trans fats, as they can contribute to liver fat accumulation. Regular exercise is also crucial, as it can aid in weight loss, improve insulin sensitivity, and promote overall liver health. Aim for at least 150 minutes of moderate-intensity aerobic activity and weekly strength training exercises. Medications. In some cases, medications may be prescribed to manage underlying conditions contributing to fatty liver disease. For instance, if an individual has diabetes, medications such as metformin may be prescribed to help control blood sugar levels and improve insulin sensitivity. In cases where high cholesterol is a concern, statins or other lipid-lowering medications may be recommended to manage cholesterol levels. However, it is essential to note that medication alone is not sufficient to treat fatty liver disease. Lifestyle changes should still be the main focus, and medication should be used with these changes as needed. Antioxidant supplements. Some studies have suggested that antioxidant supplements, such as vitamin E and vitamin C, may reduce liver inflammation associated with fatty liver disease. However, it is essential to approach supplementation cautiously and consult a healthcare professional before starting new supplements. They can guide appropriate dosages and potential interactions with other medications. It is also worth noting that relying solely on supplements without addressing underlying lifestyle factors may not provide optimal results. Regular monitoring. Regular checkups with a healthcare provider are crucial to monitor the progression of fatty liver disease and ensure appropriate management. This may involve periodic liver function tests, imaging studies, and discussions about lifestyle modifications. Monitoring can help determine the effectiveness of interventions and guide adjustments to treatment plans if needed. Managing fatty liver disease involves a comprehensive approach, including lifestyle changes, medication, antioxidant supplements, under professional guidance, and regular monitoring. It is important to remember that the effectiveness of treatment can vary depending on individual factors, such as the underlying cause and severity of the disease. Consulting with a healthcare professional is essential for an accurate diagnosis and personalized treatment plan tailored to each individual's needs. That is it for today. If you enjoyed the video, hit that like button, subscribe, and we will see you in the next one.